I will be talking about the hormonal implant, which is also called the Implanon. So, what exactly is an Implanon? It sounds very fancy, but in fact, it's a thin, flexible plastic that is the size of a cardboard matchstick. It is also comparable to the size of a regular bobby pin, if you're familiar with one. Thin plastic is inserted under the skin of the upper arm of a woman. The implanton protects women against pregnancy for up to 3 years. Since the implanton is inserted under the skin of the upper arm of a woman, you might be wondering, how exactly does this hormonal birth control method work? Well, the implant releases a hormone called progestin. This hormone is also common in other birth control methods, but that's not the point. In this case, the hormone progestin keeps the eggs from leaving the ovaries. The implanton also makes a woman's cervical mucus thicker, which keeps the sperm from getting to the eggs. Needless to say, pregnancy cannot happen if egg and sperm are unable to join. Although, although I've already mentioned that the implanton is inserted under the skin of the upper arm, there is a certain procedure for it. First, the woman or patient lies on her back, and the arm that will receive the implant has to be bent at the elbow and positioned near her head. After the patient is positioned correctly, the healthcare provider will locate a groove somewhere between the biceps and tricep muscles on the inner side of the upper arm. Some sort of painkiller or local anesthetic will then be applied to the patient. He or she will lastly use an applicator to insert the plastic stick beneath the skin, right above the large blood vessels and nerves. This entire procedure takes approximately 15 minutes in a healthcare provider's office. That only means you cannot get the small plastic stick over the counter and do it yourself. It is not a do it yourself procedure, it must be done by a professional. The implanted insertion procedure seemed very simple yet a little bit painful. You might be also wondering if such simple procedure might actually work. The answer is yes. According to Planned Parenthood, less than 1 out of 100 women become pregnant while having the implanted. The million dollar question is now, how much does it cost? The answer is free. Yes, it is free for those with insurance that covers this type of procedures. Programs such as Medicaid or other state programs also help alleviate the cost of the implanting. However, if you're the unlucky one whose health insurance does not cover this birth control method, then you're looking at paying up to $800. The implanting overall can cost anywhere from $0 to $800, like I said, depending on your income and insurance provider. So if you're paying $800 for the implanted, you better believe it is a good investment to prevent pregnancy. It is a safe, simple, and convenient birth control method. The implanted can be used while breastfeeding and can be used by women who cannot take estrogen. It also gives continuous, long-lasting birth control without sterilization. It is a hassle-free method since it is not an everyday medicine, and the best part of all, nothing needs to be put in place before vaginal intercourse. Unfortunately, there are some side effects that tag along. They may be change in sex drive, headache, nausea, and sore breasts. The implantant is very effective but not perfect. Like other birth control methods, it also carries some disadvantages and negative side effects. Fortunately, the implantant cannot be used by women with breast cancer. There's obviously going to be some pain at the insertion site and might be some discoloring or scarring of the skin over the implant. Even though I've already mentioned some side effects, the implantant has more negative side effects. Women might experience irregular bleeding such as fewer or lighter periods, longer and heavier periods, and increased spotting during periods. Although uncommon, women might also experience an infection of pain in the arm, and the last side effect, which I presume to be negative for a lot of women, is weight gain. To conclude this presentation, one last question stands. Does the hormonal implant protect you from sexually transmitted diseases? No, it does not. So remember to use a latex or female condom to reduce the risk of infection.